Charcot foot. Also known as Charcot osteoarthropathy or neuropathic joint disease. What is Charcot foot? This condition is a chronic, progressive, and destructive process that affects the bones and joints of the foot. What causes Charcot foot? Today, in the industrialized world, diabetes is the #1 cause of Charcot foot. The problem is due to lack of proprioception, the inability to feel the ground that you are walking on. Stages of Charcot foot progression. The Charcot foot disease process is generally broken down into 3 stages. Stage 1 is the acute destructive stage, which is typically characterized by profound swelling of the foot, increased temperature, and increased redness, actually due to increased circulation to the foot, which often mimics infection. The acute stage is the most critical in terms of treatment. In other words, the earlier treatment is initiated, the less damage that will result. Stage 2 is often referred to as the subacute stage. Evidence during this stage is reduced edema, reduced temperature and redness, and the absorption of the bone and cartilage fragments along with healing of any fractures. Stage 3 is then referred to as the chronic stage. The body trying to further remodel the foot, in an effort to stabilize the foot and restore joint and bone function, characterizes this stage. The problem here is that the damage has already been done. The damage done consists of a foot that no longer functions in a normal gait cycle. Because of the abnormal shape of the foot, there is usually excessive pressure points on the skin that will eventually break down and ulcerate out. Prevention of Charcot foot. Early detection and treatment is the key to avoiding excessive damage. Inspecting your feet regularly for any abnormal appearance of swelling is important. Regular medical checkups from both your medical doctor and podiatrist is equally important. In the case of suspected Charcot foot, should you notice a difference between your 2 feet, Charcot usually occurs in one foot, such as one foot is more swollen, warmer to touch or more red than the other foot. This should be brought to the immediate attention of your doctor. Treatment for a Charcot foot. Casting and immobilization treatment consists of immobilization and if possible non-weight bearing on the affected foot in an effort to curtail any further destruction. We use what is known as a total contact cast, which is cast or boot that is molded to the bottom of the foot to provide even distribution of body weight over the entire bottom of the foot and therefore to create even pressure on the foot to prevent further breakdown. Depending on the acuteness of the stage and other factors such as inadequate blood sugar control, obesity, and patient compliance, total contact casting may be necessary anywhere from 6 weeks to several months. Medication. In addition to immobilization, a class of drugs known as biphosphonites, pamidronate, are being used intravenously to help heal the bone fractures that occur. Medication would be used during the first 2 phases of the disease. Bone stimulators. In addition to medication, there has been some experimentation with bone stimulators to also heal the pathological fractures that occur. This would also be indicated during the first 2 phases of Charcot foot. Molded shoes. Treatment for the end result of the damage done usually requires special shoes that are molded to the newly deformed foot in an effort to protect bony protrusions and to prevent further breakdown. Even though the inflammatory part of the disease has diminished, we now are left with a poorly functioning foot which in itself is subject to further breakdown. Surgery. If there are parts of the foot that are left severely deformed, many times surgical intervention will be indicated in an effort to remove any excess bony prominences and to fuse any weakened joints to prevent further degradation of the foot. Most of the resulting problems are located on the bottom of the foot. For the complete article, visit www.fot-pain-explained.com/CHARCOT_FOT.html.